Hello, this is Trista, and then I am doing my video. So this is my little thing. Sorry about this, it's still on there. So right now the lungs, you see as I pull down, and then they kind of deflate, and then you pull them back up, and then they deflate, and then back up, deflate, back up. So, the first question, the answer that I kind of researched was that the balloon inflates, takes in more air, and during inhalation, the diaphragm contracts downwards, and the rib muscles pull upwards, causing the air to fill up in the lungs. Then number two, when you exhale, the balloon deflates, which pushes the air out. And then during exhalation, the diaphragm relaxes and the lungs contract, which causes the air to be pushed out of your lungs. The capacity of lungs, why some are larger than others, I found that typically men have a larger lung capacity, a greater lung capacity than women. However, most of us don't use the full lung capacity. People, such as people with like pulmonary conditions, they have to be really watched when it comes to their lung capacity. I also found as you age, the lung capacity also is lower than what it was when you were yet younger. They say about after the age of 35, the function of the lungs kind of declines. So when you get a little older, it's harder to breathe. So asthma, what happens is the walls become inflamed and swollen. Membranes within the airways the airway linings secrete excess mucus. During asthma, during like an asthma attack, the airway narrows, making it hard to breathe and causing you to cough. A lot of times when you have asthma, they do cough. Like my son, he coughed so bad with his asthma. He had it really bad for the first couple years of his life, probably until he was 4. So it was like, oh my gosh, he has that asthma cough, and he would literally cough all night long. I was like, medications, of course they use albuterol, they use steroids. I know they've used MAG on my son before. I don't know if they do it all the time, but I've seen it. The short acting beta, the anti-cholinergics inhibit the muscarinic cholinergic receptors and reduce the intrinsic vagal tone of the airway. And then the steroids, which is the most affected in alleviating symptoms, improving airway function, and decreasing peak flow variability. There's anti-leukotrienes, which they dilate the blood vessels after. So then we're coming to the meds I found online, as well as what I kind of know from my son. I know he took a lot of prednisone, albuterol, Symbicort, and then of course they've used MAG a few times when he was really bad. Some of the education you would want to give is for them to take their asthma medication every day, described as the doctor told them to, as he instructed them to, even if their asthma is okay, to go ahead and just take the medication. Monitor their asthma, watch for early signs of symptoms that get worse, monitor triggers. So if you just went around something like someone's perfume and then all of a sudden you had an asthma attack. Or I know my son, weather, when it would get really cold or really hot, it would trigger his asthma. Cats triggered his asthma. Of course, we lived out in where there's a lot of farms, so like all that dust triggered his asthma. So them are some things we got to educate patients for. Communities or resources, organizations. There's a few of them. There's the Asthma and Allergy Foundation of America, the American Lung Association, National Heart, Lung, and Blood Institute, Center for Diseases Control and Prevention, American Academy of Allergy, Asthma. Them are some of the organizations that can help give patients information, as well as things to help control their asthma, what asthma is about, things like that. And I know pulmonologists, I know if you have severe asthma enough or bad lungs, you'll see a pulmonologist like my son saw, and they were very helpful with information, education, trying different treatments. So them are some good resources for communities. And there we go. Thank you. Sorry.